All right, I'm going to go ahead and call to order the Senate Committee on Health and Human Services for May 18th at 5:47 p.m. with a roll call.
Senator Hardy. Senator Harris. Senator Kekeffer. Senator Spearman. Chair Ratty.
With that, we may be jumping around a little bit today, but we're going to go ahead and try to get some business done quickly. So we're going to start with the work session. This is a little unusual on Senate Bill 390. This is a bill that we have already work sessioned out of this committee with an amend due pass. It went over to finance. There was a pretty significant rework of this bill between the time we work sessioned it and finance took a look at it. In finance, we only dealt with the finance issue, and then they sent it back over here so that we could look at the full amendment. There are two exhibits posted that are tables that are our walkthrough to the two components of this bill. The first part of this bill is the 988 suicide hotline, and the second part of this bill is the opioid settlement framework. And so those two handouts that are a table format are probably the best to use for the walkthrough. And with that, we're going to ask Dr. Woodard, who has been heavily involved in the updates, to walk us through the amended version.
Good afternoon, and thank you, Senator Ratty. I will start with the 988 portion of SB 390. So hopefully for your reference, you have a document that is entitled Crisis Response Account 988 and Crisis Services. And I'll walk through the sections. These are not in the order in which the sections appear in the bill, but we have configured these high-level overviews in a way that I hope helps to explain what the bill is intending to do. So I'll start actually with Section 5. And in Section 5 of the bill, the crisis
Dr.
response
Woodard, I'm just going to interrupt you for a second and make sure that everybody also is looking at the right mock-up. And so, Ms. Kamlasi, it's not a mock-up, it's a...
Thank you, Madam Chair. It's in the work session document. So if you are looking online, there is a work session document for SB 390 titled that way.
Thank you. Okay, please go ahead.
So Section 5 establishes the crisis response fee and account. In this amendment, it is the State Board of Health that adopts the regulations establishing the amount of the surcharge for the 988 call center operations, mobile crisis, and crisis stabilization. In the amendment, the surcharge is not to exceed 50 cents per month per line. The surcharge is collected from telecommunications and providers and then transferred to the division. The crisis response account is developed in the state general fund. The state treasury will deposit into the account, and the division of behavioral health, public and behavioral health, will administer this account. When the money is deposited in the account, the money stays in the fund, is not reverted back to the general fund at the end of the year, so it can accumulate those dollars. And that the money will be used for 988 operations, technology, mobile crisis, and crisis stabilization as it was authorized through the federal enabling legislation. The bill also requires obligations of the Division of Public and Behavioral Health, which essentially requires us to support the implementation of the 988 hotline, establish at least one support center, and that would be the call center, encourage the establishment of mobile crisis teams, collect required information on the hotline, collaborate with Veterans Crisis Line and the National Suicide Prevention Hotline, adopt regulations, which will help to establish the qualifications of providers, as well as communication and sharing of information when entities are responding to crisis, and further delineate the definitions for qualified behavioral health providers. Important in this legislation, it also will provide liability protections for telecommunications companies. It helps to define the terms of mobile crisis teams. It also describes what the support center is required to do, as it is affiliated with the National Suicide Prevention Lifeline, and then establishes accountability, including reports concerning the usage of the hotline and associated services, which need to be reported to specific entities. And then reports concerning revenue generated by the surcharge, deposits, and expenditures. So that is a quick overview of the 988 portion of the legislation. Senator Addy, would you prefer me to pause here for questions, or would you like me to move on to the opioid settlement litigation portion of the bill?
Let's pause here for just a second. So Senator Keffer?
Thank you, Madam Chair. I think it's probably important to note that a few of the items that Ms. Woodard has outlined, or Dr. Woodard has outlined, are different than what was presented to the Senate Finance Committee earlier, well, I guess last week at this point, right? Last week. I don't know. And I think a couple of those, I just wanted to highlight a couple of those points because we're working with the telecommunications industry, who's going to be, working to establish or stand up and collect a lot of this revenue. So I think it's important. And I'd say that really it starts in Section 3 on page 4 of the bill, in subsection 3, that provides some liability protection for those telecommunications providers, which is something that I think that they had rightfully requested. If you move on to page 6 of the mock-up, section 5, subsection, or at the bottom of subsection 1, the amount of the surcharge is capped in this mock-up on the top of page 6 at 50 cents. I think that if we process this bill tonight, I'd suggest an amendment to that to 35 cents, and knowing that I believe that would provide revenue sufficient when matched through the available federal dollars to address the goals and objectives of the account. And then additionally, this provides the regulatory oversight for creating that surcharge to the State Board of Health rather than the Public Utilities Commission. And everyone will then have to go through the usual Administrative Procedures Act to walk through that regulatory process at the Board of Health and then LegCom. So I think those are the primary provisions which are different. I'm sorry, and I'll add in as well that subsection 2, paragraph B of section 5 on the middle of the page, or on page 6 as well, in lines 11 and 12, indicates that any funds generated by this new surcharge cannot be used to supplant any existing funding that currently is used for those behavioral health services. So those are the primary differences between what was presented to the Senate Finance Committee in this section of the bill and what you see in the mock-up today.
Thank you, Senator. And I'm sorry, I was multitasking a little bit. Did you mention the 35 cents?
Yes, ma'am.
Great, thank you. And we'll note for the record that we're in agreement with all of those changes. And so that is considered to be a friendly change to the bill. All right, so then, Dr. Woodard, if you would move on to the opioid settlement portion of the bill and as concisely as possible, talk through the changes there.
Sure. Stephanie Woodard again for the record, and moving on to SB 390, Fund for Resilient Nevada, and that is the opioid settlement litigation funding sections 7 through 9.5 in the bill. What this section of the bill does in section 8 is establishes the Fund for Resilient Nevada. Recoveries related to the opioid settlement or litigations are deposited into the fund. And those recoveries can be in a lump sum through scheduled payments, and likely these are going to be occurring over years. And we still don't know how much is expected to be recovered. The money deposited in the fund will stay in the fund, and its primary use is to combat the opioid epidemic. And importantly here, no more than 8% of the deposits can be used for administrative costs. It also establishes an advisory committee for Resilient Nevada Fund, and this committee is created to advise the department on the use of the recoveries related to combating the opioid epidemic. And the appointment of the members is split in part between the Attorney General, the Office of Minority Health and Equity, and the Department of Health and Human Services. This is done through the development of a needs assessment and a state plan. The needs assessment requires a number of different steps, which include community outreach using a community-based participatory research model. We also want to establish priorities and ensure that we're doing a lot of outreach to individuals who have been impacted by the opioid crisis, as well as governmental agencies. And we will also provide opportunity for the advisory committee and others to provide input into the development of the state plan. The state plan will be developed based on the needs assessment and the priorities established. And that state plan will be approved through the legislature or IFC in order for the department to distribute money from the fund according to that state plan. The department will allocate funds to statewide projects, and there's the possibility that that could include the 988 fund or the crisis response fund that I had just described in the earlier sections. Some significant changes to the version that you have before you today compared to previous versions. We really want to focus the funds for Resilient Nevada on statewide projects. However, there may be need for us to work with regional, county, local, or tribal agencies. If this is the case, then we will support those entities in developing their own needs assessments and establishing and coordinating those efforts with the state plan that we have developed. We may also distribute dollars to community-based organizations based on the needs identified in the needs assessment and subsequent state plan. And the state plan will need to be updated. I believe it's every 4 years now. And that accountability includes reports considering all of the findings and recommendations, as well as funding administered out of the account.
Thank you, Dr. Woodard. So just to highlight a few things from our the big learning that we had from the last hearing is just how specifically targeted the opioid settlement dollars are to statewide impact of the opioid epidemic. And so a lot of the work was reframing the whole process to statewide, which includes the needs assessment, the plan, the distribution process. And then importantly, I want to thank Senator Kieckeffer for leaning in and helping us with the amendments that would make sure that the legislature has a significant role in approving it during the legislative session every biennium, and then also through the IFC process. So those are the other piece that I would highlight is we, based on some of the comments from the committee members, really tightened up, making sure there are multiple places in the bill that now look at disparate impact on certain communities and make sure that we're doing outreach to lots of individuals who we may not get to otherwise. So those are the big significant changes on that. Senator Kieckeffer?
Can I have a 1-minute recess, Madam Chair?
Yes. Senator Kiekefer.
Thank you, Madam Chair. I appreciate the indulgence. So I think the intent coming out of the Finance Committee was to ensure that the account that was set up pursuant to this act would be an executive budget account, and that we would budget these funds similar to the method that we use for the Healthy Nevada Fund, so that the department would come up with an expenditure plan. It would be incorporated into their budget proposal, and we would move forward that way, make adjustments perhaps as necessary if additional settlements come in during the interim. We could do that potentially through the IFC process. I'm not positive that the amendment that I looked at previously and thought accomplished that actually does, but what I'd like to do is perhaps move forward with the amendment today, and we could maybe talk about that a little bit further. But certainly what we do have before us reinserts the role of the legislature in the process and ensures that it moves into an executive budget account rather than a non-executive one. Thank you.
Thank you, Senator Kiekefer. So with that explains all of the changes. This bill has been on a journey, let me just say. But I think we're getting it to a good place where it has a very strong programmatic side where we're making sure that the settlement dollars get used to address the impact of the opioid epidemic, as well as making sure that there's a good focus on disparate communities, and at the same time are doing the work that Senator Kiekefer has identified that is so important, that making sure that the legislature retains its ability to direct these funds in the future. So with all of that, with the committee's discretion, what I would look for is, do you have questions? Yes.
Thank you, Madam Chair. It's not a question, it's a comment. Dr. Woodard, thank you, and Senator Ratty and everybody that's worked on this bill. This is quite encouraging because this is a major step for us moving in the direction of bringing equity to the communities that have been hurt so badly in the pandemic. So thank you. Thank you. I really appreciate that.
Thank you, Senator Spearman. Thank you for pushing us on the disparate impact and inclusion pieces, and I think we got it. I think we've got it really in good shape. Senator Hardy.
Thank you, Madam Chair. So if I could understand this, I got two mock-ups that are very impressive, the work that went into them. So if I could understand it, on the Fund for Resilient Nevada, no state money is going to this unless it would be the needs assessment that needs to be done, or is this fund completely separate and distinct from any state money, therefore it doesn't have a 2/3 requirement to increase a fee or tax or whatever?
Thank you for the question, Senator Hardy. So the Fund for Resilient Nevada is a bucket that catches all of the settlement dollars into an executive budget account so that they can be appropriately handled. There would be no general fund. The bill does contemplate 8% of allowed administrative costs so that the work can be implemented, but the majority of it gets out and makes a difference.
And that brings me to, so I was correct in that assumption then. So the other one is the crisis response fee and account. And I'm not sure the State Board of Health has ever adopted regulations determining the amount of a surcharge. Is that a new concept that we're looking at?
Thank you for the question. So in that fund, that is the surcharge from the 988 to stand up the 988 hotline. And that 35 cents dumps into that fund, 35 cents per. And it is no longer, what the amendment does is it puts a cap up to 35, and then the regulatory process will determine what the actual need is, but it can go no higher than 35 cents.
But it's the regulatory board that decides something that usually is a legislative decision about how much of a fee is. I don't know of anybody that's gets to
Yep. So
determine their own fee without legislative
I'm going to
oversight.
turn it over to Eric. I actually think we have a mix of things in law where in some cases the fee is set in statute, and in others it is set by the NRS. But Eric?
Yeah, actually, that's pretty common where the legislature sets the maximum amount of a fee and the boards can prescribe less than that fee if they want. That's pretty common for like professional licensing. Most of the professional licensing boards operate that way. So.
Thank you. Thank you for that. This isn't obviously a licensing board, but that's a different issue. But, so is that the one that puts this a 2/3 vote on this
That is
portion of it?
That is correct. The 2/3 on this particular bill comes from the implementation of the new surcharge fee on the phone lines.
Thank you.
Oh, Mr. Robbins.
Yeah, I would also like to point out, I found this statute, NRS, for the licensure of medical facilities, NRS lets the State Board of Health set, or NRS 449.050 lets the State Board of Health to set application fees at an amount determined by regulation of the board. So in that case, the State Board of Health does determine what the licensing fees are.
Appreciate it. And then just as a gentle reminder, the reason for that is because we have a 988 planning grant that is underway at this time. And through the process of that 988 planning grant, we are assessing the need, which will therefore determine what the appropriate budget needs are to set that fee. All right, Dr.
Madam
Dr.
Chair.
Mr. Senator Hardy?
Thank you, I appreciate it. So the way I see this is, I mean, this is, a lot of work went into this. I'm impressed. One of the challenges I have is, where this is all going to fit at the end game, how we're going to afford this and how we're going to afford that. So I will be voting no, but very impressed and willing to look at this in a changing vote way if it all fits together. Thank you, Madam Chair.
Thank you, Senator. I will court you strongly over the next day or two. All right, with that, I'm looking for an amend to pass. Got a motion from Senator Harris, second from Senator Spearman. Seeing any discussion? Senator Keycapper.
Thank you, Madam Chair. And just making sure it's on the record that the motion includes the deviation from the mock-up from 50 to 35.
Thank you for the clarification. Yes, Senator, that would include lowering the cap to 35 cents. All right. All those in favor signify by saying aye. Aye. Any opposed? Nay. So I've got everybody in favor except for Senator Hardy. Motion passes. Want to thank the committee for the discretion. That was the oddest work session I think we have ever done, but important in terms of moving that bill along this late in the session. All right, with that, we're going to leave work session and we are going to open the hearing on SB 424 and invite Assemblywoman not 424. Let me try again. 348, Assembly Bill 348, and invite Assembly Carlton to the dais to walk us through the bill.
Thank you very much, Madam Chair and committee members. And it's nice to be on the second floor again. And I'll introduce myself as Assemblywoman Maggie Carlton, representing Assembly District 14, former senator for Senate District 21, who spent a lot of time in my life in that room there and this room here. So thank you all very much for hearing the bill today. Let me get everything together. We've all had one of those days where we're running from place to place, and I've been carrying this folder with me for most of the afternoon. So thank you again. I've introduced myself. And just to let you know, this is going to be a little piece of history. This will be the last bill that I present in this building. So, with my name on it, So, the other ones I don't put my name on. So, but moving forward. So, before you today, you have the Assembly Bill 348 in its first reprint. It went through a huge rewrite in the Assembly. The all-payer claims database that you're familiar with, I'm very sure, because this dealt with the Patient Protection Commission that accidentally ended up in this bill. So we are working from the first reprint today. So just to have a little bit of history, in working all the years on the surprise billing bill that we were very pleased and I was very honored to be part of getting past last session through a lot of those conversations. We had a side conversation, an intertwined conversation about a patient protection commission. And that was going to be a proposal last session. But when we saw the governor's budget, and he had suggested it in his budget, we let that go and we went with the governor's recommendation, and the Patient Protection Commission was set up. We all know that sometimes the first time around the block, when you set one of these things up, it doesn't exactly work the way you thought it was going to be. I want to congratulate the executive director and the president of the commission, the director of the commission, that did really, really great work over this last year. They had a number of meetings, and considering they were trying to get things done in a pandemic, but I do know it did take a while to get it set up and running. So what you have before you here today are some of the changes in the membership of the commission. It's a very short bill. I'd be happy to walk you through it section by section, but the biggest part of the bill is section 1, where we go through and we move it from the office of the director, move it from the governor's office. It was originally proposed to go to Aging and Disabilities, but in conversations through Assembly Ways and Means and Senate Finance, we found what we believe to be a better home in the office of the director. So that's the first thing that you changed, and that has been changed in the budget. So this sort of became a de facto budget implementation bill with some of these changes. Next, you go through the change in the different memberships. When you compare these memberships to the current memberships, a lot of members will be going off July 1st of this year, and other members will go off July 1st of the last year. I'll tell you that the concern that I heard, and most of those concerns I heard today, and not really before today, but today, is that folks would rather see more people come on to the Patient Protection Commission and not be replaced. The proposal in this bill is to replace some folks. It is to get this commission to the point where we are truly talking about having real data, talking about quality of healthcare, accessibility of healthcare, and the affordability of healthcare. The 11 members of the commission at this time, I believe, can honestly be viewed as industry stakeholders in a number of ways. Partway through the work that the commission was doing, I started to hear concerns about some conflict issues. And that is why in this bill you will see that we added the standard language of disclosure and conflict so that everyone knows who they're exactly representing. So that is how we tried to address that particular issue. As I said before, I think the executive director has done an excellent job with this, and I believe these changes in membership will truly make a significant difference in the work that this commission will be able to do in the future to get good hard data. As long as I've been in this building, unfortunately, we have had to make a lot of decisions based on healthcare with anecdotal data. We can now start making real decisions, and you've heard me say that before. So as you go through the membership, you'll see a lot of it being switched over to a more non-profit world than the for-profit world. Now, just because you're nonprofit doesn't mean you don't have a budget that you have to balance and you don't have to be accountable for the dollars that need to be done. But it does mean that there is a little bit of a different attitude towards it. So we tried to incorporate some of the existing positions and then change some to represent a more broad base of who we believe would actually be the best voice for patients in the future. So I would be happy to answer any questions. I cut this way back. I know you're busy. It's not a long bill, and I'm very happy to answer any questions on the bill. And also, I wanted to point out, I apologize, Madam Chair, this commission will have sole authority over the Millback Memorial Fund program that the Patient Protection Commission will be able to work on, and that aims at sustainable health care costs. So this commission will have sole authority over that, and that will be a lot of work for them to get done over this next biennium. So I'm happy to answer any questions from the committee.
Thank you, Assemblywoman Carlton. So first of all, I wanted to thank you for acknowledging that this bill had the All Payers Claims Database in it, and for working with the Executive Director of the Patient Protection Commission early in the session to make sure that we didn't have multiple vehicles and conflicting work going on. Greatly appreciated. And so with that, members, any questions? Senator Hardy.
Thank you, Madam Chair. I think the sponsor already alluded to the obvious questions that I have. If we concentrate on the nonprofits, we're basically not getting, half or more of the care that's provided by hospitals, health insurers, academic institutions, and the drug industry or the pharmaceutical industry. So that's my concern with the bill. I think realistically, we do need the data, we do need the input, and I think it's a one-armed input, and that's my concern with it. Thank you, Madam Chair.
Thank you, Senator Hardy. Any other questions or comments? Senator Kieckhofer?
Thank you, Madam Chair. Good to see you, Ms. Carlton. I'll see you again shortly. But my question is related to the health information exchange language in Section 3. We already have an exchange, or am I misreading what Section 3(1)(c) does? We've got the statewide designated health information exchange, which is, I think, working to continue to expand and build out their network of providers and facilities that are coordinating the exchange of health information. So I'm just trying to understand exactly what we're getting at in that.
I believe it's just to allow the commission to have some jurisdiction over that and work in that particular area. I understand it fairly well, but I have a really hard time, and Senator Kieckhofer, you just played stump the Assemblywoman on that.
On her last bill.
On my last bill. No, you sure did. No, as far as being able to just make sure that the interoperability of that actually works, and that the data is updated, and that the information is shared, and it does come back to the legislature, and those conversations can be had in the future.
Okay, I
But
appreciate that.
I don't want to get too far down the road, because it's something that I know about, but I am not an expert in any way, and I would hate to go down that road.
And I could dig it. So I appreciate that. And you played stump the senator on the other part, because I'm not sure what the Peterson-Milbank Program for Sustainable Healthcare Costs is. So can you tell me what that is?
It is a grant that the Patient Protection Commission, through the leadership of their director, ended up receiving, and they will be able to do a lot of work as far as addressing healthcare costs in this state. Some of the things that we've talked about in the past, cost to charge ratio versus billable cost versus network cost, out of network cost, being able to look at all the different costs across the state. And when you look at that, and then you look at the makeup of the committee, and this is in no way is meant to be insulting of any of the members that were on that committee, but we have to understand that this current committee has a true industry flavor to it. And if we're going to have real, honest, objective conversations, I believe the industry needs to step back and let other folks come forward and have those real conversations. This doesn't say that the industry can't participate. They just will not be voting members. And I believe when we get into these real discussions about healthcare cost in the future, we need to make sure that we have folks on this commission that don't have that inherent conflict of providing data and having conversations about what costs are, when their job is to be part of this commission, but they're being paid by an industry. So I'm trying to be as polite about this as possible, because I understand everyone has a job to do. I represent a group of people, so do you, Senator Kieckhofer, so do you, Senator Ratty. But we all have to make sure that we put the right people on these commissions that will make the good decisions for the state of Nevada and not for their industry.
Yeah, I appreciate that. It's certainly a fair perspective. On the
Senator, before we move on, the Peterson-Milbank grant is actually a very cool thing, and Ms. Kolhagian's on the Zoom, so if we wanted to just give her 2 minutes to just talk about it, because it is something the world should know about.
That would be great.
Ms. Kolhagian?
Thank you so much. I'm not sure, Chair Ratty, can you hear me?
We sure can.
Okay, great. Thank you so much, Chair Ratty, members of the committee. My name is Sarah Shulhagian. For the record, I serve as the Executive Director for Nevada's Patient Protection Commission. Thank you so much to Chair Ratty to give me a moment to talk about the Peterson-Milbank Program for Sustainable Healthcare Costs. It was announced back in March, it was March 9th, that Nevada joined 4 other states, Connecticut, Oregon, New Jersey, and Washington, to be a part of a program that implements spending targets to make healthcare more transparent and affordable. With Nevada's participation in this program, we are receiving technical assistance from Baylit Health, who is helping Nevada set and implement healthcare cost growth targets. These targets are really a first step towards making healthcare more affordable and transparent. What this program is really aimed to do, and the project or goals are, is to focus on the underlying causes of the rising healthcare costs and really to develop the capacity to track and benchmark healthcare spending across payers at the state level, and to analyze spending data in an effort to pinpoint cost drivers and inform interventions. I can continue to go on and talk about this, but I'm happy to take any questions about the program. It's a really exciting time for Nevada to have this multi-state collaborative effort. It's a 2-year program that really just helps our state kind of launch into establishing a benchmark and looking at healthcare spending in a data-driven way.
Thanks, Ms. Shulhagan. That's a perfect one. Senator Kekeffer?
Yeah, I appreciate that, and I do now recall that, as you said. Congratulations for leading that effort. I certainly appreciate it. And is there a requirement that we have to sort of designate a lead agency to as a part of that participation? Sometimes that happens. And tell your dog I said hi.
So, Ms. Shulhagan, the question was, is there a requirement to designate a lead agency?
Sorry, Chair Ratty, Senator Kekeffer, in this time of Zoom, I am adapting, and my little one is quite rambunctious. So if you don't mind, would you please repeat that question?
Yeah, thank you. I appreciate it. Is there a requirement that we just have to designate a lead agency as a part of the or the sort of the sole authority over participation in that? And if not, that's okay.
Thank you for the question, Senator Kekeffer. Through you, Chair Ratty, back to Senator Kekeffer. No, there is no program requirement to designate any sole agency. Rather, there is a requirement that the governor designate a state lead to manage the participation of this program. And so that is the requirement.
Thank you very much. And your puppy's super cute.
All right. Any other questions? Senator Spearman.
So, thank you, and thank you, Assemblywoman Carlton. This is exciting because I know Washington State has done this. They started in 2014, and that was the bill was introduced by Senator Randy Becker, and I believe, if I'm not mistaken, it passed on bipartisan lines because this is important information, and it will put more power in the hands of the consumer because they'll be able to see exactly what's going on. So, thank you.
Thank you, Senator. Senator Hardy.
I've waited for this moment for a long time. Senator Spearman did not say the VA hospital was going to be involved with this. And I'm just wondering if we're going to involve the VA hospital. Sunrise obviously is for-profit, but the VA hospital isn't. I do have misgivings about the one-armed approach, but are we going to involve the VA system?
Senator Carlton, would the VA hospital qualify for the nonprofit hospital seat if that was who the governor wanted
I
to
believe
appoint?
the VA is under federal jurisdiction, and I would never want to speak for the feds. I'm not sure. There would be nothing that would prohibit them from participating as far as public members and being involved in the meetings and making sure that their input was there. But as far as how they are actually classified, I am not aware of that, and I know it's purely federal jurisdiction, and I'm not sure what opportunities there would be as far as that would go. But there would be, and nothing in this bill would prohibit them from being able to be part of the conversations in public meetings as in anyone else. But with them being under a federal designation, I'm not sure how that would actually work.
Mr. Robbins, would you, if you're looking at the description of it, it's a public, not for profit, so located in a county.
Yeah, Eric Robbins, for the record. Yeah, if it's a nonprofit hospital, like a federal hospital would qualify if they were chosen and they meet the other criteria and they wanted to participate.
And thank you, Madam Chair. That's nice. That's great knowledge to know. And as this bill moves forward, letting the governor know so that as he chooses representation, he could reach out to someone at the VA and let them know that there might possibly be an opportunity for them to participate, because these members will still all be chosen by the governor. And I think that would be an excellent conversation point to have with the governor as we move forward.
Got it? All right. Committee, any other questions? All right, seeing none, Assemblywoman, if you want to step back, we're going to go ahead and open up public testimony. Is there anybody in the room who would like to testify in support of AB 348? Seeing nobody in the room, we'll go to the phone lines. Anybody, BPS, could you help us? Is there anybody on the phone who would like to testify in support of Assembly Bill 348?
Thank you, Chair. Good evening, callers. If you would like to testify in support of Assembly Bill 348, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 643. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, my name is Stacey Sasso, Executive Director for the Health Services Coalition, representing 25 employer and union-sponsored health plans in Southern Nevada. We are in support of AB 348 today. When the governor formed the PPC, it was with the intention of protecting the patient, with price focus being one of those topics. In order for the commission to be effective, we need to ensure patient voices are front and center of the PPC, not just have the industry perspective when healthcare policy recommendations are being shaped. The PPC's main mission should be to examine healthcare access, quality, and affordability in the state, and make policy recommendations to continue to improve the overall healthcare system in Nevada for the patient. The coalition is hopeful the opportunity provided by this commission is realized, ensuring a voice for the patient. Thank you.
Thank you. Next caller.
Caller with the last 3 digits, 796. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good evening, Madam Chair, members of the committee. For the record, Rusty McAllister, RUSTYMCALLISTER. I'm the Executive Secretary Treasurer with the Nevada State AFL-CIO, representing 150,000 members across the state and their families. We are in support of this bill. We believe this is a good policy. We believe that this will provide information on behalf of the people that actually utilize health services. We believe that this will be provide more of a perspective from the health people who utilize the health services, as opposed to those that are run the hospital industry or run the medical industry. And most of all, we believe that the positions who would advocate on the most important part of this system, this will provide information for those most important parts of the system, the patients. It's a good way for them to be represented as opposed to just those in the industry. So for those reasons, Madam Chair, we're in support of this bill.
Thank you. Next caller?
Thank you, Chair. You have no additional callers in support at this time.
Okay, I believe I skipped over the Zoom video. Ms. Holmes, did you want to testify in support?
Yes, I would. Thank you so much, Madam Chair. For the record, this is Maya Holmes from the Culinary Health Fund. Governor Sisolak's 2019 decision and the legislature's support to create the Patient Protection Commission was really an essential step to improve our healthcare system for all Nevadans. The PPC's primary goal is examining and proposing solutions to address access, quality, and affordability in our healthcare system. There is no question Nevadans need and deserve access to high quality, affordable healthcare. Unfortunately, ensuring the PPC is getting directly patient perspectives and experiences has really been a challenge. We would like the PPC to be a voice for patients, which can then be the backbone in developing effective policy solutions. We support AB 348 and Assemblywoman Carleton's efforts to ensure a diversity of critical patient voices and stakeholders in our healthcare system are represented on the commission. The inclusion of more members with a history of advocating on behalf of insured and uninsured patients and working in the nonprofit sector is simply essential. The new voices will bring specific and much needed patient-centered expertise crucial to the commission's work. We believe the intent of AB 348 is to maintain a commission size that does not become unwieldy, but really expands the breadth of expertise to ensure a greater focus on and a broader range of patient experiences are really balanced with the industry perspectives and interests. We also support Assemblywoman Carleton's efforts to address any conflicts of interest, adopt needed bylaws, and place the PPC within the Department of Health and Human Services. This will ensure it has the additional tools and the structure it needs to achieve its goals. We really urge the committee to support AB 348. Thank you so much.
Thank you. All right, I believe that's everybody who needs to testify in support. We're going to go now to opposition. Anybody in the room who would like to testify in opposition? Seeing none. On the phone line, do we have anybody who'd like to testify in opposition?
Thank you, Chair. If you'd like to testify in opposition of Assembly Bill 348, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition of Assembly Bill 348, please press star 9 now to take your place in the queue. Chair, you have no callers indicating opposition at this time.
I appreciate it. All right, we will go to neutral. Is there anybody in the room who'd like to testify in? We'll go to neutral. I did do opposition in the room, right? Okay. Mr. Wadhams, good to see you. Mr. Ross, please go ahead, Mr. Wadhams.
Thank you, Madam Chair, members of the committee. My name is Jim Wadhams, W-A-D-H-A-M-S, with Black and Wadhams appearing on behalf of the Nevada Hospital Association. Although we appear in neutral, I want to state very clearly we have no opposition to expanding the additional membership on the Patient Protection Commission. We think that additional perspective is very helpful. This commission, I think, had a difficult start because the board was not fully appointed until approximately January, and unfortunately within about 30 days or so after its first meeting, we went into the COVID crisis, and that constrained some of the activity. We do, however, believe that ultimately the committee produced 2 bills that I think are moving through this process well. SB 5, which has to do with telemedicine, which is proven through the COVID crisis to be a significant opportunity to make sure that people who, particularly during a lockdown period and otherwise, still have access to care. And the all-payer claims database, which Assemblywoman Carleton has mentioned, becomes part of SB 40, and that seems to be moving through the process. Our concern, however, is that eliminating one of the positions representing hospitals, there are two in the bill and on the current commission. Eliminating that upon the expiration of either one of those terms, I think, is problematic. Nevada has over 35 short-term acute care hospitals in Nevada. spread over northern Nevada, southern Nevada, and rural Nevada. There are county hospitals, district hospitals, nonprofit hospitals, and for-profit hospitals. And as we just learned, there may be an opportunity for a federal hospital as well. That is a wide diversity in the scope. Currently, under the mix of our short-term hospitals, 92% of the patient days are accessed in private hospitals. And in order to fully evaluate cost, we think that that information on the cost drivers of the delivery of that service is critical. The voice of that care and the cost of that care should be available to a more broadly expanded commission so that the perspective of the delivery of that care can be blended into the consideration of the cost and the use of that care. We note too that the governor created the commission with the help of the legislature in 2019. And he took care to identify the positions that should be part of the balance of that body, and then specifically had the authority to identify those individuals. And during the COVID emergency, we noted the governor focused his COVID task force on maintaining hospital capacity and issued a declaration to the Patient Protection Commission to particularly learn the lessons that would be experienced during the COVID crisis. When hospitals were asked to expand capacity dramatically to accommodate patient admissions that at one point were over 2,000 a day. Very, very serious problem. So the perspective that comes from the variety and the differentiation of the different hospitals, I think, is going to be critical even for an expanded Patient Protection Commission. So we have no concern about the expansion of that commission, but would request that the committee consider reinstating at least one more hospital to provide some of the diversity of that perspective and the cost drivers that go with that. Thank you, Madam Chair and members of the committee. We'll be happy to participate any further on other discussions.
Thank you, Mr. Bottoms. Mr. Ross.
Good evening, Madam Chair, members of the committee. My name is George Ross, R-O-S-S, speaking on behalf of HCA Healthcare. We will echo the words of Mr. Bottoms, but I would like to add a few comments. We are neutral because we completely agree with the objectives that the sponsor of this bill stated: quality, access, affordability. And I think the key there in this is that, as Mr. Waters pointed out, 92% of the patient beds are in the private sector. This state has essentially, for the last 50 or 60 years, relied upon the private sector to keep up the amount and the investments in healthcare that the state needs to keep up with its growing population. Similarly, all the investments, virtually all the investments, in other than what UMC is able to do, are in the private sector in terms of new quality, both in terms of how you practice it, how you apply it, and how you bring in new features and new treatments. This all comes through the private sector. So it's imperative that if we're talking about access, we're talking about quality, that we must take into account their needs. You just can't take them totally for granted. And finally, affordability. Again, this is a matter of cost, and especially given that the PPC has just begun the Peterson-Milbank work. You need people on that committee who understand the practical side of healthcare, understand those costs. So we would strongly urge you to add back a hospital site member in addition to what's in the bill, and make it just plain a hospital member and not specifically say nonprofit, because the private sector provides so much of the health care in this state. Their perspective is needed and their knowledge is needed. So that I thank you again for your attention and for the opportunity, and I do thank all of you for the work you do this session and others on healthcare quality and access. Thank you.
Thank you, Mr. Ross. Mr. Fenseth.
Madam Chair, good evening. Rocky Fenseth with Carrera, Nevada, here representing Pharma. Pharma supports Governor Sisolak's efforts at creating the Patient Protection Commission. We also applaud the hard work of the executive director over the last 2 years leading into this legislative session. Respectfully, we would, as my esteemed colleagues have mentioned, we would request insertion of the pharmaceutical representative back in the Patient Protection Commission. We support the expansion of the body. Thanks.
Thank you. Anybody else who would like to testify on neutral? Seeing none, we'll go to the phone lines. Anybody on the phone who would like to testify on neutral?
Thank you, Chair. Callers, if you would like to testify in a neutral position on Assembly Bill 348, please press star 9 now to take your place in the queue. Again, if you'd like to testify in a neutral position, please press star 9 now. Caller with the last 3 digits, 582. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
My name is Jaron Hildebrand, and I'm the Executive Director of the Nevada State Medical Association. I know you've had a long night, so I'll keep my comments brief. I would just like to echo the comments of my colleagues before me. Again, we would like to see our seats remain, and we don't disagree with the initiatives that Chair Carlton is putting before us. I want to discuss access to care, quality health care. Our over 2,000 physician members and the unique patient mix that these folks see on a daily basis, I feel that we also would bring a value to the Patient Protection Commission in addition to an FQHC physician, and bring other perspectives throughout the state and a broad spectrum of healthcare policy. Again, we'd like to thank the committee and Chair Carlton, but again, we would like to see our added to the patient protection. Thank you.
Thank you. Any additional neutral testimony?
Yes, Chair. Caller with the last 3 digits of 653. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good evening. This is Dora Martinez, Doramartinez. Madam Chair, I was really wanting to call in support. May I please proceed?
Thank you. If we would just note for the record, Ms. Millette, as often happens with our new technology, we're going to go ahead and let this flip back to support for a minute.
Thank you so much. I will blame my service dog, Sarge. Okay, so I am here representing the Nevada Disability Peer Action Coalition, and we ditto the support folks who called in, and we just want to give a big, huge shout out to Assemblywoman Carlton, the forever beautiful, powerful, graceful, brilliant Assemblywoman Carlton. We thank you and the rest of the Resilient Committee. Thank you and have a great evening.
Is there anybody else who would like to testify on neutral?
Chair, you have no other callers on the line at this time.
Well, that seems fitting. We're going to go ahead and close the public testimony. And I guess if you're presenting the last bill of your 24-year history of presenting bills, it seems only fitting that we would end with a caller who is going to call you brilliant and beautiful. And I can't even figure out how many other wonderful adjectives there were there. So with that, Assemblywoman Carlton, any closing comments?
And thank you very much, Madam Chair. I think it's time to leave on that high note before I mess it up in the next 6 or 7 days, because I'm planning on 6 or 7 days. So thank you very much for having a hearing on the bill today. I found the neutral testimony quite unique. I did not get this neutral testimony in the Assembly. There was one person with the health plans that did testify in neutral. I did hear from Pharma today in the hallway. There was a hallway conversation on this. Mr. Ross did share his concerns by text very late this morning with me. And Mr. Wadhams and I go way back, so we know how that works, right? So could have predicted where they were going to be, but I believe where you see the bill right now is a very good position. I'm not sure if there was an actual proposed amendment, but I did amend the bill in the Assembly. Dr. Titus brought up a concern. It was a valid concern. I did amend it, but I still didn't get her vote. So I think I'm done amending the bill. Thank you, Madam Chair.
Thank you, Ms. Carlton. So with that, we'll go ahead and close. Any clarifying questions anyone needs answered? All right. So with that, we're going to go ahead and close, excuse me, close the hearing. We have reached that point in session where it is important that we move things along relatively quickly, and so it's my intention to go ahead and work session the bill today. I will start with my comments. I've been relatively intimately involved with the Patient Protection Commission since it was first created. The Patient Protection Commission bill originated in the Senate last session, and I worked closely with then Allison Combs in that position to try to figure out what might work. And I think the model was to throw some stakeholders who are not always on the same page in a room for a while and see if we could come up with a way where we could come up with some solutions where everybody had some significant buy-in. And then both of the bills that came out of the Patient Protection Commission originated in the Senate this time, and probably have spent more time working on the Patient Protection Commission bills in this legislative session than I have combined on all of my own personal bills. And I'm going to just say I'm not sure it's working. I think that a lot of people put a lot of really hard work in to try to make it work, and I'm not casting any aspersions. I think that there's been good and sincere efforts. I want to thank Ms. Schulhagen for the significant time and energy and work that she's put in. I think she's done an excellent job as the executive director, trying to, as we will always say, herd cats. But I am okay with trying something a little new to get more of the patient advocate voice involved. I may have a bias. I come from the nonprofit sector. But what I will say is I've always felt, thinking of, in my neck of the woods, renowned hospital. I'm not sure, or when St. Mary's was a nonprofit, I think that a nonprofit and a for-profit hospital have far more in common than, a small business and a small nonprofit have more in common, and a large business and a large nonprofit have more in common. And those nonprofit hospitals are dealing with all the same cost management and insurance, and the only thing that they're not dealing with is trying to pay attention for the profits for their shareholders. That's my personal opinion. But again, I'm ready to support this and try something new. And I feel like I've been relatively engaged in this process, and have tried to be a good neutral player to continue to move things along. But I hope that whether you have a seat on the board or not, that everybody stays engaged and we continue to try to figure out how to work together as people who care about advancing healthcare. And maybe that's my tired at the end of the session speech, but I will be supporting the bill in its current form. Anybody else? Senator Kiefer.
Thank you, Madam Chair. I certainly appreciate the Assemblywoman's sort of policy take on the changes that she wants to make. I would never ask for an amendment and then vote against the bill. But if in the future she decides that she does want to make an amendment, I'll be happy to entertain that, and we could have that discussion. But for the time being, I think that taking out the voice of some of the most significant payers within the healthcare system, I think, is a problem, as well as some of the significant cost drivers as well. So just more of a philosophical difference on the voices. But so for now, it'll be a no. But I don't think she wants to have that conversation. So all right, thanks.
Anyone else? Senator Hardy.
Thank you, Madam Chair. Obviously, I've said what I've thought. I think we're not doing ourselves a service to have a diversity in the representation in more than just one diversity. Likewise, I think I would look forward to these meetings to see how this particular body can actually increase the number of physicians that we have in the state of Nevada, and I think that is a glaring problem that we have, and I would hope that this particular body addresses that. Thank you.
Thank you. Any other comments? All right, seeing none, I'm looking for a motion of due pass. Got a motion from Senator Spearman, seconded by Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? So I've got Spearman, Harris, Ratty in favor, Kiefer, Hardy opposed. Motion passes. Thank you, everyone. All right, we are going to go ahead and jump back to the work session for Senate Bill 424. If we could, Ms. Kamasi, if you could take us through that.
Thank you, Madam Chair. Megan Kamlasi with the Research Division of the Legislative Council Bureau for the record. Senate Bill 424 was heard in committee on May 13th. It creates the Public Health Resource Office within the Division of Public and Behavioral Health of the Department of Health and Human Services, and it provides for the appointment of the Public Health Resource Officer to oversee the office. The office must perform certain duties to improve public health in Nevada, including analyzing existing infrastructure for public health needs and identifying and making recommendations regarding unmet needs for public health services, federal and private funding opportunities, and ways to improve coordination between public health providers. 3 amendments were proposed to this bill. The attached mock-up, which establishes the Public Health Resource Office in the Office of the Governor instead of within DHHS, was proposed by the sponsor during the bill hearing. Following the bill hearing, the Office of the Governor proposed adding an appropriation to fund 2 full-time non-classified employees in the Public Health Resource Office, and that appropriation is listed on the bill page. And finally, Senator Spearman proposed a conceptual amendment following the bill hearing, and this would add an appropriation to the Office of Minority Health to hire a Health Program Specialist 1. And this person must research and make policy recommendations to the Public Health Resource Officer regarding strategies to address disparate health outcomes in communities of Black, Indigenous, and other persons of color, resulting from systemic racism and structures of racial discrimination, as well as disparate health outcomes in rural communities and other underserved communities.
Okay, so had a little bit of movement on this one. Thank you to Senator Spearman for bringing forward the amendment to make sure that this effort to address the public health pandemic also has the lens of the pandemic that is racial justice and disparate impact of health. And then we've done some work to make sure that the appropriations are in place when the bill goes over, which I assume will be grabbed by Finance Committee when it comes out, and that we know what the dollar amount is that we're talking about. Anybody have any questions on this one? Got an amend do pass from Senator Hardy, second from Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. All right, I think I forgot to do floor statements, so on 348, I'll take the floor statement. 390, I will also take the floor statement. And Senator Spearman, would you like to take 424? All right. With that, we have concluded our business for the day. On Monday, sorry, I just jumped quite a far ahead. On Thursday, we'll be hearing AB 191, AB 216, and AB 256, and AB 192. And let's go ahead and open it up for public comment. Doesn't look like we have anybody in the room. BPS, is there anybody on the line who'd like to make public comment?
Thank you, Chair. If you would like to speak in public comment, please press *9 now to take your place in the queue. Again, if you would like to speak in public comment, please press *9 now. Chair, you have no callers at this time.
Thank you. With that, everybody, thank you for your efforts. We are adjourned.